Hi, my name is Dr. Tori Hudson. I'm a naturopathic physician. I want to spend a few minutes talking about hormone replacement therapy or hormone therapy for perimenopausal and postmenopausal women. And what I actually want to focus these few minutes on is helping you to be less afraid. Unfortunately, in the last 12 years, there's been a lot of accentuating the negatives of hormone replacement therapy. And those things, while there are always benefits and risks, there are actually more benefits than risks to hormone replacement therapy. But more to the point, it's important to address your individual benefits and your individual risks of taking something like hormones for the long haul with someone who's qualified to really give you a good individual assessment of the benefits and the risks. One of the things I say to my patients every day is that the worst thing I could say about taking estrogen and a progestogen for more than 3 to 4 years in peri or postmenopause is that it will ever so slightly increase the risk of breast cancer. And we're talking about 8 more women per 10,000 women per year would get breast cancer if they took an estrogen with a synthetic progestin. And you notice I'm qualifying that now because there are now 4 studies, 3 French studies and 1 US study that shows that when the recipe of the estrogen and the progestogen includes a bioidentical natural progesterone with any kind of estrogen, there was actually no increased risk of breast cancer. And while 4 studies isn't optimal to determine all things and the truth of things, it really emphasizes that there is a difference and that there is a way to take hormones with possibly no risk. So I tell my patients, so if the worst we could say is 8 out of 10,000 women per year, and these 4 studies say no increased risk if the recipe was the natural progesterone with the estrogen. So it's somewhere between 0 and 8 women per year. And that's 8 and 1 is more than we want. But that's, I think, really changes the perspective. If you need hormone replacement therapy to improve your quality of life in ways that you're suffering that other solutions haven't worked, and or if you need hormone replacement therapy as the optimal choice for prevention or treatment of a certain chronic healthcare problem, it can be done in a very safe way. The other thing about hormones is delivery. There are friendlier deliveries of estrogen than others. For example, if you take estrogen through the skin, either in a patch or a cream for a systemic hormone effect, that actually is better on the heart, better on the triglycerides, better on inflammatory markers, better on your decreasing your risk for any kind of a clot from taking estrogen, versus oral estrogen, especially in the first year, can slightly increase your risk of a stroke or a clot. It can increase the triglycerides, which is a fat, and it kind of slows down your liver metabolism, you might say, which is how it kind of affects this triglyceride issue. So if you have something unpolitely called fatty liver, if you have type 2 diabetes and you're in a position that maybe the benefits of taking estrogen are more important for you than the risks, then that would be a situation where we would especially want you to take a transdermal delivery of estrogen through a patch or a cream. And something like a compounding pharmacy can provide even more options to you and your physician than are available through a regular pharmacy, because we have special recipes, special blends, special doses, special deliveries that conventional pharmaceutical companies don't yet offer. So we can compound estrogen with progesterone, with testosterone, in a cream, in a unique dose that really is customized for your particular situation. And then we've talked before about vaginal estrogen for the purpose of relieving vaginal dryness or urinary leakage or vaginal discomfort or pain. Vaginal estrogen is essentially completely safe if it's dosed in a maintenance dose of twice a week, and it comes in a cream or a tablet. And again, there's a few conventional options, and there's even more compounded, special customized formulas in creams and bases. Especially if you're an allergic and sensitive person, we can give you a cream that's hypoallergenic and therefore not going to irritate you at all. So there's a much bigger story to hormone replacement therapy, and for you as an individual, we can assess what are the benefits, what are the risks, what's the optimal thing to do for you, and to find a doctor that's really a good menopause practitioner. They might be a great doctor, but they might not be a great menopause practitioner, and that's really what you want to look for. And also, ideally, a menopause practitioner who understands the whole spectrum of options from lifestyle to nutrients to botanicals to hormones, and also really is up to date on the research on the benefits and the risk of hormone replacement therapy. And hopefully this little tidbit might help you feel a little less afraid if you're in the position of thinking about taking hormones or already taking them. Thank you very much.